in healthcare. What is DIP? Digital image processing. So by using design thinking, we are going to explore how DIP used in healthcare. So can anyone say what is design thinking?
So design thinking is a human-centric approach to solving a problem.
Very good. So design thinking is a human-centric and creative problem-solving approach for solving a problem very quickly by testing the prototype. Okay. So I think you all are familiar with the 5 stages of design thinking. Can you say?
There are 5 stages in design thinking.
Okay.
Empathy, define, ideate, prototype, and last step is testing.
Okay. So empathy means it is understanding the user requirement or customer requirement. Okay, customer needs. Okay, for solving a problem or for designing a product. Okay. Then define means it is a problem statement. It is a problem statement. And ideate. The third stage is ideate. Ideate means creating ideas to solve to find a solution for the problem. And the last two stages are testing and prototype and testing. So we can make a design or we can make a product, and the final stage is testing. Okay. First stage is empathy. So what would be the empathy point for using digital image processing in healthcare?
So the empathy what we have here is when a lot of crowd happens, enough of the patients are not giving enough care to prioritize themselves.
Okay.
So this is one point. Another point is when they get complex image processing X-rays or MRIs, it should be easier to convey to them as a doctor to the patient, so that it will be very much helpful.
Okay. So here in healthcare, the customers are patients. Am I right?
Yes.
Okay. So and doctors also involved. Okay. So doctors and patients are the customers as concerned in digital image processing in healthcare. Okay. So doctors need accurate and clear image for their diagnosis, and patients wants faster and painless treatment for their treatment. Okay. So digital image processing helps to resolve all those things, because it is difficult to find the small tumors in the MRI scan or CT scan. Okay. So in this digital image processing can be used to solve all those problems. Okay. So the define. How can we define? So the healthcare needs accurate and safer treatment for accurate images for doctor's diagnosis, and it should reduce the anxiety of patients. So this is the define. Okay. So what are all the ideations? Okay. So DIP. So there are some 10 components in digital image processing. The first one is image acquisition. So image acquisition can be taken using sensors. Okay, and image enhancement. Okay, image enhancement and image restoration, image segmentation, and object recognition, and morphological image processing, color image processing, or the components of digital image processing. But we are using digital acquisition in healthcare. We use MRI scan or CT scan as the image acquisition unit. And image enhancement. Image enhancement means to enhance the image, that is by improving contrast and brightness. This is very useful for tumor detection and for organ visibility. We can use image enhancement. And the next one is image restoration. So that is the image restoration is restoring the image from blur or image for in CT scan, or it can come with some noise, or it can be blurred. So image restoration technique can be used to that is the filters in image restoration. The filters can be used to remove noise, and it can be used for remove blurring. Okay, and image segmentation. So image segmentation, it is dividing the images into small segments. Okay, so it is very useful for that is abnormal region, to separate abnormal region, and object recognition. It is also used in healthcare. So all these components are in healthcare unit are used for EC diagnosis and for to reduce the patient accident. Okay. So can anyone summarize the points, today's points? Today's topic.
Yes, we discussed 5 components in healthcare. So first is image acquisition, that is capturing the image from the sensor or any kind of devices. And next is image enhancement, that is clear vision of the image. And next is image segmentation, so that is segmenting the anomalies in the reduction. And next, last is object reduction. So in that, clear picture of view is getting by doctors to detect EC anomalies or EC tumors or anything in healthcare by using this digital signal processing.
Very good.